The World Health Organization reports that about 24 million people were infected with malaria in 2020. 95% of the cases were in Africa, and most victims were children under 5. More than 80% of Zambians are at risk of malaria. Partners for a Malaria-Free Zambia program, a Rotary Club-led initiative in partnership with World Vision and the Bill and Melinda Gates Foundation, has an ambitious goal of reducing the incidence of malaria by 90% in 10 target districts in the Central and Muchinga provinces in Zambia. Martha Lungu is Executive Director of Malaria Partners in Zambia. She elaborates on the impact of malaria in Zambia and the progress and aspirations of the program.
For Rotary, through Malaria Partners Zambia and other partners, we supporting the implementation of the training of community health workers. These are volunteers within their communities. And what we currently do is we help Ministry of Health to train these community health workers in integrated community case management. The most affected are actually the pregnant women and the children under the age of 5. Personally, I've had malaria several times, and unfortunately, I lost my son in 2020 to malaria. That was the most painful time in my life. It was very devastating. Being an advocate for this global eradication of malaria, and it hitting me in such a manner, I wouldn't wish it upon anyone. I feel the need now to put in more effort in this fight against malaria, because I really don't wish for any mother losing a child because of malaria, a disease that we can prevent and treat. We don't really need to take this disease casually, and I seem to think that maybe that's what happened with my son, because for it to get to severity is only because there is delay in treatment. It actually would take a lot of partners coming on board, and a lot of interventions, and a lot of financing. We spend more than $1,000 to just train and equip one community health worker. So we are talking about training 36,000. So it's a lot of money required. They say together we can end malaria, meaning we need more hands, we need more efforts, more resources. I think maybe it's time we started considering other interventions, other new ideas. What I would really want to voice out now, maybe especially to our government, is that they need to ensure that the medications and test kits are readily available. It seems to be a waste of resource to train community health workers when the medications, the test kits are not given to them. I hope for a Zambia that is free of malaria. I look up that one day my grandchildren, my great-grandchildren will wake up and just hear of malaria as a story of the past.